This is Dr. Adam Rinde, and today's episode is called Coronavirus Behind the Front Lines. This episode is intended to talk about what it's like for us healthcare providers who are outside the hospital setting and how we've been dealing with the coronavirus. I'm not going to speak about treatments for coronavirus or prevention, just wanting to share some insights and reflections on the process thus far. We may be joined in progress by some other providers that have been invited. However, I'm just going to go ahead and start talking a little bit. It dawned on me in practice that this may become an ordeal way back in January when we started hearing about the outbreak in China, January of 2020. Started hearing about just the magnitude of people who are being diagnosed with COVID-19. And that really started to kind of plant the seeds of how this may have more of an impact. But reading about it in the news, you sort of continue to feel detached. And I'll talk further about when things started to hit home. But I first want to take a step back and just say that um, my whole mode of approach during this coronavirus has been to take off the hat of the clinician that's in private practice and put on the hat of more of a public health mindset. And so I've really trying to think about what's right for the community and what's right for our healthcare system. And of course, at the same time, what's right for the patients that I care for. But it's been a shift when seeing that the decisions and the filters that we run our practice through have changed dramatically. So I just want to say I wholeheartedly am concerned about our community and concerned about the world's health, and everything that I've run through my kind of perspective on is based on working together with the whole healthcare system to help us get back on track as a world, as a community, as a local community, as a global community. So I'm going to go into talking about some of the things that really deeply changed me in practice. And the moment that I was really changed by this was when, towards the end of February, we started hearing about this is February 2020. We started hearing about the outbreak that had taken place in one of the local facilities that have that cares for elders and um, people who have serious health conditions who are more towards the latter part of their life. This is in Kirkland, Washington, which is 5 or 6 miles away from my office. And the people who were living there, we started to hear that there was some deaths and that this was starting to increase, and there was 3 deaths, 4 deaths, 6 deaths. And so all of a sudden they isolated that in our community that this coronavirus had landed. And at the time it was thought to be not as alarming from a global perspective, as of course very upsetting that all these people were dying so rapidly. And eventually I think it got up to 12 or more patients in that early phase that had died in that life center facility in Kirkland. And at that point, it was thought that perhaps this virus was contained to this population, and really, um, most of us just sort of went about our business, of course, with an eye on the situation there. Now, for me, that sense of feeling of containment of virus was very short lived because we had uh, interactions with people that I work with as patients who were intimately involved with that condition, some as first responders, medics, and firemen, firewomen, fire professionals that were on the scene that had some exposure. And keep in mind, this was early where people were completely caught off guard about what might be going on and the kind of protection that was needed. And then also, some of my patients who are dealing with immune conditions that knew of people who had been in the center and had exposed them, potentially exposed them to this virus. So, right away, within the first few days of this outbreak, early March, people I was working with had already been impacted and potentially um, had transmission of this virus. So, as a provider, I felt like I had to get my act in gear, and really, just like anybody, it was we were sort of unprepared for what might be coming. At that point, um, the transmission concerns were very high, and people started to panic. And I remember in early March, there started to be some news about that this epidemic was going to hit our area. And that's the first time I started seeing the supermarkets starting to be cleared out of food and toilet paper. And just sort of a mass hysteria kicked in, because in our country, we hadn't seen it yet. And we had no one to learn from. And there really wasn't much understanding of entirely what was going on in China, other than thousands and thousands of people were being diagnosed, and thousands of people were dying. We didn't really understand how that translated to what we needed to do here. So I actually early on went into more of a survival mode. I started researching all the different ways and weapons we might have against viruses, and started thinking about diet and hygiene, and started putting together talks on the immune system, and basically going back to the basics of my training of like antiviral nutrition and hygiene practices to help prevent virus, and spent a lot of time diving in and just making sure I knew what we needed to have in place to fight this virus. And then wanting to communicate with the people I'm caring for, to be prepared. And I remember having many conversations early in that part of the process where I was maybe hyper alert, hyper vigilant, and I'll speak to that later. And other people were just kind of like, "Do you really think this is going to be a big deal?" And some people were taking it seriously. A lot of people were just kind of neutral, and many people were just not really thinking this is going to be a big deal. And I felt like I was talking to myself. But I was enrolled at the time, and I still am, in a postdoctoral program through Cogent's Immunology. And so I was really involved with studying the immune system basically for the last 12 months. And I couldn't have thought of a better way to prepare me for understanding what we need to do. So I started to really dive into the physiology of natural killer cells and T cells and how to fight viruses. So at the time, I just sort of really kicked into gear into what I could do. Um, Having a background in having dealt with like a life-threatening condition within my family. Um, I had a son who was a cancer patient, Jordan, and we were dealing with through his cancer battles before he passed away. We were dealing with these kinds of threats all the time because of immunosuppression. If someone coughed near him, we would, potentially have a life-threatening line infection, um, within hours. So we, I was kind of coming from a mindset of what we had to do to keep him well and keep him out of harm's way. And to to be honest, like I really went into a very unhealthy, kind of overdriven place in the beginning of this coronavirus outbreak. And so I was staying up and trying to figure out how to basically protect everybody I know and everybody I'm caring for from getting infected, and reached a point where I exhausted what I knew, and I realized I still didn't know if I could help people and protect them. But that is kind of the process that anybody goes through when they're dealing with a problem that's way complex. It's like you get into a situation where you reach your max, and you have to go with what you know. So further on in these early days, I touched base with a friend of mine who's a very dear friend, and she was telling me, with her autoimmune condition, how and her immune suppression that she has based on medications, that she was starting to develop symptoms, and she needed to go into the hospital. And I had lost touch with her during that process, and she was deeply on my mind. And before I know it, within 3 to 7 days of this all starting, I was hearing about and interacting with people who potentially were going down the road of serious symptoms related to COVID-19. At that point, I think the community and people started to slowly take this more and more serious. And we've kind of now gone through these different phases where we're taking it more and more serious. We started the physical distancing. Businesses started shutting down in our area. Microsoft will started telling all their employees to stay home. Amazon, Google, and we started to see that this was just a huge ordeal. And still, it just felt like there's all degrees of what people were willing to do in this early days of taking this seriously, and getting on board with physical distancing. And um, I'll say that one of the most challenging things for this is that um, there are there's sort of this sense of what's happening with all the health conditions that people were dealing with prior to the coronavirus threat. And so this has taken center stage with most of my patients. And what's been really interesting and also very complex about this is that this is kind of in the lower brain centers, and some of the because it's an immediate threat, and a more pressing threat, and a more life threatening threat than we've experienced in as a community. And some of the other problems that we are dealing with, sort of chronic problems such as like blood pressure issues or digestive issues or other autoimmune conditions, sleep disorders, have kind of been pushed in the background, um, a little bit. And in fact, it's really complicated matters because people are overwhelmed with knowing what they need to do and what to focus on. And so I'd say the second and third week of this has been about getting situated with health plans that not only are focused on coronavirus prevention and helping the community prevent the spread, but also making sure that people's health issues that they have pre-existing are not being mismanaged. And so it's really complicated measures. Um, that would I would say that that's been the biggest issue. And what I've seen in the second and third week is more panic about making sure that people have months and months of supplies of medications, and also making sure that people are, you know, having immune support, and that their immunity is fully equipped to deal with threats. And what has ratcheted up is the extreme anxiety around this unknown. And that is, sort of the biggest thing right now, um, from a standpoint of as a provider outside of the health facilities. So I'm not in a hospital, I'm not in the ICU. I'm actually sitting in a place of trying to prevent people from having to use those services. Number one, because they'll they might be unknowingly exposing themselves to someone with the virus if they go into the facility prematurely, but also them going into the facility prematurely will put pressure on the system that's already about to break, meaning the hospital beds, the short staff, the lack of personal protection equipment. And so when I'm getting calls from people, or people wanting to discuss the potential of symptoms, we're sitting here without tests widely available to determine if someone has coronavirus, and we're sitting here kind of trying to, with the data we have from the World Health Organization, the CDC, South Korea, and China, to figure out if this is someone who needs to go into a healthcare facility, or if we can prevent them from going into a healthcare facility. So, for example, if someone has like a cough or a sore throat, or malaise, or kind of fatigue, and they're really anxious about the coronavirus, well, for that particular person, they want to figure out really fast if this is something they have, so that they can make adjustments in their life. But for the healthcare system, right now, that person may or may not be a good resource, a good use of resources if we bring them into the hospital. And so it's very tricky right now, to sit back and make decisions, from what little tools we have. So what I will say is, the expansion of telemedicine has allowed us to at least interface and see people and ask questions and watch their body language, and see how sick they appear, and you can get a sense of how well they're breathing, and we can talk about temperature, and we can get a general appearance of how someone is uh, is feeling. And so it's been really challenging, to make these different calls. Um, Now, people who are obviously sick, it's a fairly straightforward kind of discussion about getting them into the right facility for immediate care. And this is probably the trickiest thing about this right now is the, you know, how do we care for people who are home and worried? And, so I think the other tricky thing that's been um, a big kind of shocker is the lack of personal protection equipment. So if we do need to see people, or if we do need to test people outpatient, we're very limited with gowns and masks and anything to protect ourselves. And so it creates an additional barrier to getting care. And plus, if you work in an office building and you're bringing in someone with the virus, it affects other people, other businesses. It's very complicated in figuring out how to do this right. So ultimately, I think treating people from home is a really safe and effective way to go about this. And so that's really what I've been trying to focus on for the most part. And then also seeing protocols for curbside testing has been something that I've been really focusing on. So people who could drive up and get tested from their car. That way, if they did cough or did have the virus, that the viral load is likely not leaving their immediate environment and exposing other people or office buildings or that type of thing. Um, so, I think those are some of the things I've been experiencing a lot. I just say from an emotional standpoint, um, as a provider, I think about a lot of the people who are in the hospital, and having spent weeks and weeks in the ICU as a parent with a sick child, I will just say that these people are definitely my heroes. People who work in an ICU are just some of the most brilliant, equipped, strong, calm people I've ever witnessed. And I think about these people a lot. And I almost wish I was in there with them. And it kind of pains me that I'm not, because I just feel like I could help, and that I could help navigate this situation. And the fact that I can't go in there because I'm not licensed and I don't have the proper advanced training is just something that really, I just feel like I'm missing out on, because I feel like I want to be there and I want to be helping on as deep level as possible. Um, I think this is something we all experience in as parents of sick children, or as a caregiver of a sick person, or just as a healthcare provider. Is sometimes you reach a point where you feel like you're feeling helpless. You wish you could do more, but you have to kind of do your part and just trust the system. And from my perspective, I just keep thinking about the nurses, the docs, the people in these settings that are dealing with a chaotic, uh, out of control, volatile situation. And having been there at a very volatile and controllable part of my life, and seeing a very volatile, uncontrollable situations manifest in ICUs, just I trust the leadership that these people have in those moments is just incredible. And I think what I see a lot is, sort of a very simplifying approach, not trying to do too much at once. We can really learn from what goes on in the ICU in our lives and take it out into what we're doing in the community, which is be predictable, move methodically, go inward, and just make very tactical decisions Don't do too many leaps or jumps, in your decision making. In the ICU, things generally follow a very well thought out checklist process to minimize mistakes. And uh, when something happens, these people have a training they go to. I think about this book by Atul Gawande, who it's about checklists, and he's a lot of the ICUs and emergency rooms have followed with this model of checklist. But really, we can learn a lot. And I'm not there, but I'm trying to imagine myself there and in these moments where things are so uncertain and use some of the qualities and techniques that are there. So let me give you an example. What we say that comes out of our mouth in a chaotic situation can either cause chaos or bring stability or just be neutral. So we may think we have ideas or something that might help, but if it's not really solid in a chaotic environment and it's just coming out of our mouths or we're just kind of jumping, it just adds more chaos. But if we take a step back and we think, how is what am I about to do or say going to add stability or value to the situation to restore homeostasis to the person in front of me, to the condition in front of me, to the system in front of me? How is it going to do this? And that's exactly the model in a ICU, where uh, they're really trying to bring homeostasis to a situation. So I've been trying to take this and magnify it outside of the ICU into my office and into my home. I think it's not easy because we all have our limits of how much stress and containment we can have. And, there's things that leak, especially, being cooped up in a home with our loved ones at this point, and everybody's sort of around each other a lot. And there's all different emotions, and people are way out of their routines. And, so even in that system, things could be said that could cause chaos and hurtfulness to others. And we really need to just kind of take this model and just use it. Um, we're all, in a sense, never away from threat. And we all in our life, even though we never imagined we'd see something like this, we've always been under threat. We just kind of have an illusion that we're not. And this really brings to light how, in a very uncontrollable world, with lots of different threats and things, that stability and calmness is key. And this has been the biggest lesson for me, is to bring order and stability through my thoughts and my actions and my interactions with people. And through that, we can prevent this virus from really damaging us and for making help having us make mistakes or slip ups or cause harm or damage. Now you realize I didn't talk anything about vitamin C, vitamin A, mushroom extracts, astragalus, or anything like that, because to me, those are all treatments and strategies, and I think they're all important. It's a time for a different topic. But I really just wanted to kind of come on here and just share where I'm at, document this experience, share what I've gone through, some of the things I've learned, and uh, kind of a mindset and some of the gifts of this COVID-19 experience thus far. I'm not sure if there will be another one of these talks, but I thought it was important just to kind of come on here and share some thoughts and reflections. Thank you very much for tuning in, and everybody stay well. I'm sending my prayers and blessings to all of you, and that we shall continue to get stronger and stronger to as a community and in our bodies and in our minds to help us deal with these chaotic times and move on as a stronger people and a stronger nation and a stronger world and a world with peace. Thank you guys for tuning in. We'll talk to you down the road.